Hello, welcome to Health and Social Care. If you want to make a real difference to people's lives, then health and social care may be the right career for you. According to labour market information, it is one of the sectors with the highest growth in jobs in our local area, with many large employers, such as the NHS, on our doorstep. If you'd like to study health and social care at Filton campus, there are 4 options. You can start at level 1. And the entry requirements for that are GCSE grade 2 in English language and maths. For those of you that have a grade 3 at English language and maths, you can look at studying the level 2 certificate. For those of you who have studied health and social care already at school, we have an alternative level 2 option, and it's called Common Health Conditions. I will go into more detail about all of these courses as we go through the presentation. If you're interested in going to university to train to be a nurse or a midwife or a social worker or many other professions in health or care, then you may like to look at doing our level 3 health and social care course. This is equivalent to 3 A-levels. Okay, so let's take a look at the level 1 certificate to start off. And you can see from the list of units that you study on this course, it's a very diverse course, and it's very good for people if you're not sure whether you want to work with children or older people or people with particular conditions in health and care. So this is a very wide-ranging course with lots of different units to help get you ready for working in the sector. You can study English and maths alongside this course. Our level 2 course is ideal if you need to resit up to 3 GCSEs. So if you have, if you need to resit maths, English and science, for example, then you may be able to do that alongside this course. And so the number of units on this course is lower to give you more time to focus on your GCSEs. So this course has 3 units, but they're very important fundamental units for health and social care. For those of you that have done level 2 health and social care at school, this may be an ideal alternative if you don't yet have what you need to start the level 3 course. So for the Common Health Conditions course, we are looking at particular health issues, such as those shown on the slide. You will look at these conditions in detail, and you will look at how we monitor and support people who have those particular conditions. You can resit GCSEs or functional skills alongside this course. If you have achieved at least 5 GCSEs at grade 4 and above, including English language, maths and science, then you may like to start at level 3. This is a 2-year course, but in each year you will have a qualification at the end of each year. So in year 1, the qualification you will achieve is called the Technical Certificate in Health and Social Care, and depending on the grade that you achieve for the course, you can accrue up to 84 UCAS tariff points. The subjects you study at level 3 are very similar to the subjects that you study all the way through the levels, but there are a few additional things added on to this particular course. So you'll be looking now at studying more specialist areas such as psychology, sociology, working in health and social care and reflective practice, as well as doing a unit on infection prevention and control. So if you will get to the end of year 1, you will achieve the technical certificate in health and social care. Some people at that point choose to move into work-based learning. Other people may think, no, I want to go to university and I'm going to stay for the 2 years. And that will enable you then to achieve the UCAS points you need for a degree course. So in year 2, you can then top up your UCAS points to up to 168, depending on your grade, and that gives you an equivalent to 3 A-levels. And these are the subjects that you would study on year 2 of the course. So again, you're looking at more specialist areas now, in year 2, including an anatomy and physiology unit that is an exam unit. So that's the only exam you will need to do for the course, but we'll talk a little bit more about that in a later slide. So, work placement is an essential part of studying health and social care. It's where you will gain your experience, and it will help you to work out whether this really is the area for you, or whether maybe you prefer working with a particular type of service user. So in level 1, you will have 3 separate block weeks, and it's really good to have 3 different placements so that you can try out different things and find out what is the best fit for you. Learners studying level 2 and level 3 health and social care will need to attend work placement 1 day a week, and that will start in October and run through till the end of May. And we will have 2 separate block weeks where you can try something different on those weeks. The idea of placement really is to help you find things that you enjoy, and also to maybe find things that you don't enjoy, because that helps you to work out which direction to take your career in. Work placement is really good because it helps you to make the links between what you're learning in the classroom and the real world of work. So that really helps you to improve your employability and to do really well when you have a job interview or a university interview. It's really good if your placement can relate to your future career aspirations. So if you are looking to work as an adult nurse, for example, it would be really good to work in care homes and to start to understand the challenges and rewards of working in that setting. If you want to be a midwife, you may like to look at attending antenatal classes, working alongside local midwives, and seeing actually how they conduct their roles. So there are many different placements you can secure in Bristol. We have lots of really good links with placement providers, and hopefully then you will be able to tailor your placements to suit your personal career goals. There's no harm in starting to have a look around your local area now. So do a search on Google, see if you can find out what services there are in your local area, and start thinking about where you might like to do some work experience. Now, working in health and social care requires you to have something called a DBS check to be done, and it demonstrates that you are safe to be working with people who might be considered to be vulnerable. So this is a check that's carried out at the start of the year, and it will cost around £50 and 40 pence this year. I don't know what next year's fee will be, but that's what it was this year. But you will require that DBS check to be done so that you can demonstrate that you are safe to work with people. If you have had any convictions or cautions, please do let us know when you apply, so that we can then give you the correct advice as to whether it's going to prevent you securing placements or securing jobs in health and social care. It really does depend on what the conviction is and when it happened, so we would need to give personal advice on that. Now, all of our courses obviously have assessments, and I'm just going to talk to you a little bit about how that works. So all of the courses that we run are mostly assessed through internally marked coursework. So level 1 and level 2, there are no exams. All of the assessment is internally marked. For the level 3 course, it's a slightly different. Across the 2 years, you will study 18 units. Now, in year 1, there will also be something called a controlled assessment, which is basically like supervised coursework. So you will be in college for up to 20 hours, not all at once, obviously, it will be spread across a week. And you will have some coursework to do that you will have to work on completely independently, and that will be sent off to the exam board to be marked. You have the same thing again in year 2. So you have one controlled assessment in year 1 and another one in year 2. In year 2, you also have the anatomy and physiology exam that I mentioned earlier. So the level 3 course, although 17 out of the 18 units are internally marked as coursework, you do have these 2 controlled assessments and the exam added on to that. For all of the coursework that's internally marked, there is an upgrade opportunity. So you will be able to submit your work. We will mark that for you. And if you've missed something or you need to develop your work in order to pass, we can then give you that feedback and you will be able to resubmit that work as long as you meet the assignment deadlines. So our learners often progress from one course to the next. So you may start at level 1, you may end up progressing through the courses to level 3 and then on to university. But it really depends on your own personal choices. It might be that you do a year and then you want to go into the workplace, or that you want to continue at college. We are happy for you to continue through the courses as long as you've demonstrated that you're making general good progress and that you are demonstrating the values and behaviours required to work in health and social care. That is really important. We are looking to see that people are generally kind and compassionate and have the right character to work with people who may be vulnerable. So if you've done level 1 or a level 2 course, what do you do next? Your choices are maybe to go and work in the sector, and you can take on support roles with a level 1 or a level 2 health and social care course. So that would involve more work-based training. And these are some of the roles that some of our students have gone into. Employment areas, you're looking at places like hospitals, care homes, there may be community centres that people would like to work in. Or you may decide at the end of level 1 or 2 that you want to continue at college and studying health and social care, or even transfer to another academic area. Some average pay scales for people who start at band 2 or level 2. We are looking at NHS scales here. So as a band 2 worker in the NHS, those are the scales currently, pay scales. So what can you do once you've completed your level 3 technical extended diploma? Let's take a look. You may choose to go to university to train for one of these careers. There are 4 types of nursing: adult nursing, children's nursing, mental health nursing, and learning disability nursing. You may choose to go and study a particular subject that's related to the area, such as these. Typical places of employment for people who have studied these courses are in hospitals and community-based settings. Not everybody wants to go to university, and there are some routes for apprenticeship training. So for example, in adult nursing, that can be done either at university or through an apprenticeship route currently. On the screen now, you will see some average pay scales, and these are pay scales that are on the current agenda for change, and they are for registered professionals. So these are the kinds of pay scales that you would achieve once you have completed your registration and done your training for these particular professions. For more information, if you go to one of these websites, you will see there's a lot more information about health careers in general. There are many more than the ones I've shown on the slide here, so you can find out more about lots of different careers and how you can get into those. So why should you come to SGS College? On the team we have health and care professionals who have spent many years working in the sector, including a former paramedic, social worker, care manager, practice development teacher with the NHS, and staff with a background in psychology and sociology. We have many years of teaching experience between us. This enables our learners to develop a real understanding of how theory links to real-life working situations. We have excellent links with local health and care providers, to enable you to secure a good work placement and to support your progression into employment or university at the end of your course. If you would like to apply for a course in health and social care at Filton campus, please go to our website. Click on the word study and then health and social care, and then follow the links to apply for the course of your choice. Thank you very much for listening to me today.